I'm Bendix Carstensen. I'm a senior statistician at the Steno Diabetes Center Copenhagen, where I've been working for 25 years. My background is statistics, and my work is mostly in diabetes epidemiology, and normally I say in the realm of demography of diabetes, how diabetes is in the population. There are like two aspects of this. One aspect is what happens to people with diabetes if they come down with a cancer diagnosis and are subject to treatment. So some of the speakers tomorrow will talk about the complications, also sort of the social and economic complications you can have as a diabetes patient in relation to how well you are treated for your cancer if you're already a diabetes patient. The other aspect is what I've just been talking about today, which is what is the occurrence rate of cancer among people with diabetes, and whether this depends on the patient's use of the different kinds of diabetes drugs. So briefly, during the last 10 to 15 years, 3 new major drug classes have come to market, namely DPP-4, GLP-1 and SGLT2 drugs. And this means that we now have 15 years of market exposure to the diabetes population of these drugs. And this is starting to be sufficiently long time to see if there is any elevated cancer occurrence associated with the use of these drugs. And the study we've done, which covers the entire Danish population, basically shows that there is no excess cancers. So we see a few types of cancer that are overrepresented among people on various of the drugs, but these will most likely be attributable to what is called confounding by indication. You will see that the drugs GLP-1 are likely much more frequent in people with large levels of BMI, obesity, and we also see that among those people there is an increased occurrence of cancers that are associated with obesity. So it's, you could say, a clear example of confounding by indication. The result is really negative in the sense, or you could say it's positive in the sense that there's very little indication that any of the new drugs has any influence on the cancer occurrence among people with diabetes. So the point here is that if you make studies where you say we only compare this single drug with that single drug and we're only looking at this specific type of cancer, then you're very likely to come up with spurious results. So that's why our study was aiming to say we look at all drugs and we look at the effect of all different types of cancer. And of course you will come up with some results that sort of shows an excess or a deficit, but that is most likely to be a spurious finding attributable to random error, basically. I don't think there are any cancers that are diabetes related in the sense that diabetes patients should be treated differently in terms of screening for cancer. So you could say the broad effect of the broad message from the study we have conducted is that Diabetes patients are, in terms of cancer, not very different from people without diabetes. So the recommendation would be screening for cancer has nothing to do with whether you are diabetic or not.